Hi friends, this is your friend Dr. Sujata Naik, Homeopath, once again coming to you with some clinical tips and hints to manage some problems with homeopathy. And today I'm going to talk to you about a very common condition these days, and that is known as PCOS, Polycystic Ovarian Syndrome. It is becoming a very common problem in girls of reproductive age, like say most common between 18 and 35. And although the reason is really not completely known as yet, but modern lifestyle has a huge role in contributing towards this disease. And I wouldn't really call it a disease, it's more or less called a syndrome now. It's a symptom complex in which basically a girl will experience irregular menses. She has problems with, there's an increase in the male hormones, and that is why that leads to hirsutism, that is unwanted hair in other parts of the body, and sometimes weight gain or obesity. And in women who are married, sometimes infertility could be one of the complications of PCOS. So for causes unknown, the ovaries of a person of PCOS, a woman of PCOS, will have immature follicles which have unruptured eggs, and these lead to increase in the male hormones, and that leads to irregular cycles, obesity, and increase in the unwanted hair in parts of the body. So the modern medicine has only hormonal treatment for this, and we know that it's a double-edged sword, comes with its own side effects. But homeopathy as a line of treatment is very safe, very secure, and has been observed to offer excellent results in girls with PCOS. So along with lifestyle management, that is, you see nowadays girls are into sedentary jobs, sitting all the time, not really exercising, are eating, have irregular hours of sleep, not enough rest, and even diet mostly is very, very unhealthy. So you have girls eating junk food these days. All this leads to an increase in the midriff fat. So there's a lot of fat around the abdomen, early obesity, and that leads to a condition called as insulin resistance. And that itself can make the girl prone to PCOS. So PCOS, although is something that needs medication, but lifestyle has a huge role to play in it. So correction of lifestyle being the important thing. So enough exercise, a diet which is low in dairy, low in fat, and low in saturated fats, in trans fats, lots of fruits, vegetables, a lot of water, enough walking, exercise, good sleep, and a calm basically lots of peace of mind. All these factors can contribute towards menses getting irregular. Basically control of weight and then menses getting regular, and then gradually can also help in reduction of follicles. So homeopathy has lots of medicines. Homeopathy not only tackles the problem by giving the medicines to alter the deranged menstrual cycle, but it also has medicines which can help the root cause. For example, a lot of girls, because of overwork and stress, women in the 18 to 35 age group, a lot of them suffer from a lot of career stress these days. As a result of which there's depression, and there's something called as emotional eating. So they get into an overdrive where they work, and then eat, and then sleep at irregular hours, and leading to all these complications. So homeopathy will get to the root of the problems, whether it is depression, whether it is a kind of a stress, or whether it is an emotional setback due to any reason which has contributed to this factor. It will definitely tackle this. Sometimes genes also have a role to play. So if a mother has had a history of PCOS, or a sister has a history of PCOS, the girl generally tends to fall in line. So we can actually correct these problems at the root. And there are several medicines for PCOS like pulsatilla, you have calcarea carb, you have natrum mute, you have sepia, you have graphitis, and so on and so forth, and many of them can actually not only tackle the problem but can reverse the PCOS completely if given at the right time, and if it is accurately indicated. So if any of you have a condition known as PCOS and you're not sure what to do, consult your local homeopath and get constitutional treatment which will tackle the problem at its root. And meanwhile, don't forget that all those lifestyle errors that you've made need to be corrected as well, because without them, no medicine is going to act. Thank you very much. See you next episode. Bye-bye.